Hi, welcome to my treatment group video for the diagnostic category of obsessive compulsive and related disorders. I will be presenting on body dysmorphic disorder. My name is Dr. Tristen Smith. My client is Luca Ciapella, and he is age 42. Now, the only differential diagnosis we have for this case is body dysmorphic disorder. And this differential diagnosis only has one primary diagnostic feature, and that is preoccupation with imagined deficit in one's appearance or disproportional concern regarding slight deficit. Going on to Luca's story, Luca is being assessed after a suicide attempt. He was found unconscious in his car after he tried to kill himself using gas asphyxiation. He requested to be assessed in a dark room, and when he entered, he was wearing a baseball cap real low. He was slouched over, and when he spoke, he refused to make eye contact, and he spoke in a very low and slow manner. Luca explains that he and his wife recently separated, and he just couldn't bear the pain anymore, so he tried to take his own life. He also describes that he has no friends and he was recently fired from his job. When asked about why he was fired from his job, Lucas says that he was fired simply because he was too ugly. But further explanation goes to show that he was actually fired because he missed so much work due to his perceived facial deformities. He describes these deformities as a misshapen nose, eyes that are too closely set, a chin that protrudes, and chronic skin blemishes. He indicates that he's been obsessed with his appearance ever since he was a teenager, but his dissatisfaction has steadily increased over the past 5 years. And he is very convinced that everybody can see his deformities and that they will either laugh at him or be completely repulsed by him. However, all these deformities that Luca claims he has are not apparent to the evaluator. In fact, most people would actually agree that Luca is a very handsome man. But despite this, he still sees himself as repulsive. Moreover, he describes having irresistible impulses to keep checking on his deformities in the mirror, often for hours at a time. And this has led Luca to start missing more and more work. He stopped going out with his friends and wife, and he started to become very anxious when people would look at him, so he started avoiding going out of the house. Sometimes when he did go out of the house, he would actually drive through red lights because he was so afraid that the person next to him would be staring at him. More seriously, Luca even sought out a dermatologist who would agree to do a dermabrasion on his perceived facial blemishes. He went through with the procedure, but Luca states that he could see no improvements whatsoever. So he asked the same doctor to do reconstructive surgery on his chin and nose. Of course, the doctor refused and encouraged Luca to seek psychiatric evaluation. Alright, moreover, we're going to go over the multi-axial diagnosis. On axis 1, we have body dysmorphic disorder. Axis 2, none. Axis 3, a recent suicide attempt. Axis 4, he was separated from his wife and fired from his job. Axis 5, his GAF is 54. Moving on to theoretical perspectives, we have 3. The first one is the biological perspective. Luca's abnormal behavior may have a genetic predisposition. Research also shows that there are many abnormalities in certain brain structures such as the limbic system, the frontal cortex, and temporal lobe. Inadequate connectivity between these areas can lead to emotional and cognitive regulation defects, contributing to his abnormal behavior. Neurotransmitters also may play a role in his disorder. Luca might have a deficit of serotonin, and moreover, engaging in his compulsive behavior results in the secretion of dopamine, which is going to cause a pleasurable effect, thus contributing to further compulsions. The next perspective we have is the behavioral perspective. Luca's behavior may be the cause of faulty learning experiences, specifically operant conditioning. He is negatively reinforced with the removal of anxiety when he engages in repetitive mirror checking. And he is also negatively reinforced further with his avoidance behaviors that also reduces his anxiety. Now, the last theoretical perspective we have for Luca is the cognitive perspective. Luca's behavior may be due to irrational beliefs. He believes that people will judge him solely based on his appearance, and he thinks that his appearance might be a reflection of his true self. Moreover, selective thinking may also cause him to oversee any positive attributes in his appearance. Therefore, Luca will only see the ugly in himself. That's all we have for this case study. I hope you enjoyed.